As we continue celebrating Black History Month, it is important to acknowledge Heart Health Month as well. In fact, there's a connection between the two.
Heart disease is the #1 cause of death for Americans, and research shows that Black Americans are 54% more likely to die from heart disease when compared to white Americans. News 7's Raya Wooten tonight explains what factors play a role in the grave differences in heart health when analyzed by race.
Chest pain, shortness of breath, cold sweats, difficulty breathing.
All things that Northern Light physician Christopher O'Connell says could be signs of a heart attack or some form of heart disease.
It could not show any symptoms, and that's the scary part.
Dr. Pius Osai-Bagina, who specializes in internal medicine at Northern Light, says heart disease is the leading cause of death in the U.S. He explains risk factors like obesity, high blood pressure, and high cholesterol all cause your heart to overwork. And when the heart gets tired,
then the heart is going to begin to give up.
Hitting Black Americans the hardest.
And their risk for having some type of heart disease is almost 60% over the age of 40, which is a lot higher than Caucasian populations.
But the question is why. O'Connell says one component is genetics.
Sodium or salt metabolism. For some reason, they may not be able to metabolize salt as well, and that can lead to things like high blood pressure.
But Osai-Bagina says socioeconomic disparities between Black and white racial groups act as independent risk factors.
If you have situations where certain racial groups don't have access to the same level of healthcare, or same level of education, or same level of environment, then definitely the system is set up in a way that, some people are naturally going to be predisposed to some of these conditions as well.
Significantly contributing to the extreme differences in disproportionate effects of heart disease. Yeah. O'Connell says new research shows that when socioeconomic risk factors like stress, wage gaps, and access to adequate health care are removed,
you can almost get that comparison between Caucasian and Americans and Black Americans almost to a 0% difference.
In Bangor, Raya Wooten, News Center, Maine.